Good afternoon, everyone, and welcome. We'll just give it a few more seconds as everyone joins us today. All right, thank you everyone for joining us. We'll just start in just a few seconds as we have a full session today. All right, let's get started. Well, hello everyone, and welcome to our first industry showcase of the year on February 21st. My name is Ashley Caesar. I am the Programs and Events Specialist here at Digital Health Canada. All right, so today's industry showcase is called Reimagining an Incumbent Healthcare Organization as a Connected Digital Enterprise. And it is a pleasure to introduce you all to our presenters. We'll start with Kevin Webster. He's our Chief Operating Officer at Bayshore HealthCare. We have Diraj Paul. He's our Chief Digital Transformation Officer at Bayshore HealthCare. We have Anita Fitches. She's our Director of Integrated Care Solutions at Bayshore HealthCare. We also have Sherry Natashin Webster. She's our Managing Director for CarePath and CareCharge, digital health part of Bayshore HealthCare. We have Peter Jones, Healthcare Industry Lead with Microsoft Canada. And we also have Erin Smith. She's our Director of National Specialty Pharmacy at Bayshore Specialty RX. All right, so we will have time for Q&A at the end of today's presentation. So please type your questions in the chat box at any time. All right, so thank you all for being here today. A warm welcome. And I'll now pass the screen over to you, Kevin.
Thank you, Ashley. We're honored today at Bayshore to have the privilege of presenting, and want to thank Ashley and Digital Health Canada for this opportunity, as it's a chance for us to talk a little bit about our journey and our story as an organization around digital transformation, some of the things we've done, some of the things we've learned, talk about it from a very high level, and then also from some very specific use cases of where we're using our digital technologies to make a difference. Bayshore is a large organization, was born, and the foundation of everything we do is built on caring for people and patients across Canada. We're a national organization, and we're very proud of the work we do, and very committed to looking after people at some of the most difficult and challenging times of their lives. Next. In terms of what does Bayshore do, we are an organization that operates outside of hospital. We have a national footprint, and we're really looking as an organization to work in solving three big problems. Aging in place is becoming a big challenge, obviously, across Western societies, including Canada. Treatment of chronic disease outside of hospital, and then looking at where we can innovate. There's an enormous opportunity to do more care at home, and we're constantly looking at ways that we can be a partner to make that happen with the healthcare system. This is a simplistic sort of look at our national footprint as an organization. We deliver over 20 million hours of care annually. We have 350,000 Canadians that we look after and provide care to. We have 5,000 nurses. Our footprint includes 80 plus home care locations where we have teams across the country from Newfoundland to Victoria. We have 11 infusion pharmacies across the country as well, one in every province and 2 in Ontario. And we have a whole range of community care clinics, again, located from Victoria across the country, as far east as Newfoundland. So we are a national organization and committed to playing in every part of the healthcare system outside of hospital in the country. Next. We have a very diverse group of employees. We have 18,000 healthcare staff, and across the country, we're quite proud of the diversity that we have as an organization. 85% of our staff identify as women, 70 plus languages are spoken by our employees across the country, and 50% of our staff are born outside of Canada. We have a great, diverse, talented group of people, the power of this organization on a day-to-day basis. We made a significant investment, which we're going to be talking about over the next half an hour, 45 minutes, in in technology as an organization. We felt it was important to step up. Obviously, there's an enormous opportunity that was before us. The healthcare system is clunky. The experiences are difficult at times. There's expectations are changing. People are coming to the table, as we all know, with bigger expectations. We saw this as an enormous opportunity as an organization to really build an experience for patients, families, and our employees that was much more convenient, much more transparent, and that would allow personalization. In addition, we see as an organization that we have a responsibility as an incumbent to really ensure data moves more easily across the healthcare system. So our investments in technology were about allowing that to happen and bringing partners to the table that would allow us to ensure we have the ability to move data. It's not all there in healthcare yet. Interoperability is still a significant challenge, but we like to think we're not an impediment to that at this point. We can help make data move where it's required with partners in the healthcare system. And finally, a lot of organizations, small companies, disruptors, startups have come into the ecosystem over the last decade. Many of them have struggled to figure healthcare out. Healthcare is hard. We have a deep knowledge of understanding how healthcare runs outside of hospitals, and we're able to bring that knowledge and integrate it with technology in some really interesting ways. Where some of the startups that have come out, we've worked with a lot of them. They do struggle in the complexity of healthcare and trying to figure out how to do some of these things, and sometimes in an industry that many times could be a bit irrational in terms of decision making and how things are done. Next slide. So the next thing I just wanted to introduce is we have a video coming up that will play that gives you a high level understanding of the journey we've been on and some of the things we're trying to accomplish as an organization before we touch and connect with each of the additional speakers.
For most Canadians, healthcare today is not convenient or easy to access. We believe we are on a journey to change that. At Bayshore, we focus most of our energy on serving two main populations, those needing help and those providing help. Our vision is to own and perfect the digital front door from which these populations interact with us. Our mission is to help patients navigate the fragmented healthcare journey ecosystem outside the hospital. We believe one size does not fit all, so we set ourselves up to handle dynamic situations with a focus on providing seamless engagement through One Bayshore and My Bayshore Care. With more than 55 years in the home and community healthcare industry, we know what needs to be done to keep employees and patients safe to drive positive outcomes. Our highly concurrent event streaming architecture, powered by both AWS and Microsoft Azure, provides the scalability and reliability necessary for handling our complex data processing demands. Our API management layer offers seamless communication between different components of the architecture. We focus on filing and delivering prescriptions from our pharmacy, having a virtual consultation with a pharmacist, monitoring clients' vitals with remote patient monitoring, escalating events to required parties, and even delivering flowers to loved ones. Our virtual healthcare offerings are powered by the secure video conferencing capabilities of Zoom for Healthcare and Microsoft Teams, providing patients with convenient and accessible virtual care options. Our digital experience platform, hardened in Microsoft Cloud for Healthcare and AWS, securely integrates with a range of electronic health records, electronic medical records, customer relationship management, and scheduling systems, providing a comprehensive solution tailored to each customer's unique requirements. At the heart of our architecture is MongoDB Atlas, a highly scalable and secure cloud database. By using MongoDB Atlas, our suite of digital offering can easily scale horizontally on demand, build multi-tenant solutions, providing robust, flexible, and secure data management. Regardless of how the care occurs, relevant data points are immediately captured, tracked, and reported across various systems. At the end of the day, we are a people company, and our every touch point needs to be meaningful. We believe incumbent organizations need to invest in interoperability to drive the convergence of care and technology to ensure a connected ecosystem evolves outside the hospital.
So that's a high-level overview of some of the things that we've been moving forward with as an organization. At this point, what I'd like to do is introduce Peter Jones, Microsoft. Peter's been a great partner to work with, and I'd just like to call on him to say a few words before we move on to additional speakers. Peter?
Yeah, thanks, Kevin. Good morning, everybody. Thanks for joining us. What I wanted to do is talk to you a little bit about what Microsoft is doing in the healthcare sector and what we're doing to help partners like Bayshore, digitally transform and how to build that compliant infrastructure to really address a lot of those changing needs in healthcare. So if you think about this, I wanted to share this slide. This really talks about, building that blueprint of how we need to develop and change the health system. And a lot of what Kevin talked about is how do we get access to the right data at the right place at the right time? And as we know, healthcare is moving outside the walls of the hospital. So how do we build a system that allows for strong clinical collaboration as that patient transitions from acute care to community care to home care? And how do we ensure that we have the right data at the right place at the right time? What Microsoft is really building out an ecosystem or a platform in which both hospitals and our partners like Bayshore are leveraging to enable that. Next slide, please. So you heard us talk about, if you want to just build that out, go ahead. There's about transitions there. So Microsoft has really brought to market a secure, compliant infrastructure for healthcare organizations to build applications on. And this is really what our investment is in the market, which is really ensuring that our tools and technology are leveraged through our Azure services to build out things around virtual care, remote patient monitoring, and really harnessing the data across the healthcare system. And we brought a lot of this to market really with that quadruple aim, and we're talking about the quintuple aim around equity of care in the future. So we're really building these industry compliant clouds that makes it easier to digitally transform the healthcare sector across the board. Next slide, please. So if you think about virtual health and what that looks like and what organizations like Bayshore are trying to build out to serve patients in the home and being able to provide that seamless delivery of care, you saw in the video where they talk about building this digital front door to get access to information and really be able to deliver access to healthcare across the board. Here's an example of a lot of the work that Bayshore is building out, right? You think about patient intake, you think about virtual waiting rooms and clinician collaboration. As that PSW is doing work with the patient in the home, how do we start to connect back in with everybody on the care team and start to bring that communication across the system? A lot of organizations have invested heavily in Teams as a clinical collaboration platform, and we're starting to share information across the system on that clinical collaboration platform. So this just gives you an example of how we're evolving in the market with that secure, compliant infrastructure that organizations like Bayshore is leveraging. Next slide, please. So, as the patient tries to navigate the healthcare system, we're starting to see really a journey map that really starts to develop and how that patient interacts with the healthcare system. And you'll see today from the Bayshore team a good example of how that is happening and how they're enabling that across the healthcare system. So with that, I'll turn it over to the Bayshore team, but this gives you a sense of all the work they're doing, and especially around the virtual care space, which I think is allowing for that ability to have the patient stay in the home and receive the best care possible, whether they're being monitored remotely, whether it's a virtual interaction with somebody on their care team. We're really starting to see the uptake of these new digital tools to really improve patient care. Thank you.
Thank you, Peter. Appreciate the comments. I'd like to introduce Diraj Paul, who is our visionary and really the lead of digital transformation at Bayshore. Over to you, Diraj.
Thank you, Kevin. Good afternoon, everyone. So you saw a small video which actually sums up what we are planning to do and what kind of problems we are trying to solve. 4 years ago, we as leaders came together to see how can we think differently to solve some of this move, because since we are a large organization, we are diverse, we operate different lines of businesses across Bayshore. We have patients coming from different channels. whether it is from system referrals, from direct or integrated care, or through hospitals. How do we actually manage the journey of the patients to make sure they get a world-class experience when they're working with us? So since we are a legacy organization, a lot of legacy applications are running in the shop. We wanted to take an approach, a platform approach, to move the data between on-prem systems to cloud so that we can start to innovate faster. We can start designing certain experiences using design thinking along with patients, their family members, and the care staff that we have. Such a large network that we can bring a lot of those problem-solving scenarios with the user. So we started taking a platform approach, build out, moving the data into the cloud. We started with AWS, we extended to Microsoft Cloud. We started hardening the data in the cloud so that we can start working with the data to drive the experiences. That's what we call it as a digital experience platform, which helped us augmenting a lot of plug and play technologies, great technologies, which is out in the market. We have integrated with Stripes, MongoDB, Kafka, Twilio for driving digital secure communications. So it just provided a digital launch pad for us to start looking at, okay, now how are we going to solve certain experience-driven scenarios for our patients and families, and also for our staff. Next slide, please, Patrick. So when we look at a digital platform as a launchpad, that's where we started building out a couple of digital front doors. One digital front door is for our patients and families to interact with the care, who is coming to the care, how does their mom feel like today, wellness statuses, care plans, all those data that they asked they wanted to see. And also with our staff, we built out one Bayshore, which is a digital front door for our field mobile workforce, just to see how they can communicate with our clinical operators, branch operators, so that we can provide that care at the point. Along with that, we also start building out certain digital capabilities into this digital front doors. Some of those capabilities we have named as Wave, which is a virtual visit platform, which has been verified by Ontario Health. We have Vantage, which actually drives our remote patient monitoring capabilities, which is hardening in Microsoft Cloud for Healthcare, which actually helps us harmonize those HL7 data into a file format. So we are able to do a lot of those personalization scenarios from that point. We also support nurse navigation programs. There's a few presenters who will be presenting more about those use cases. So this is how we are imagining how digital is actually taking us forward. It's a journey. There's been a lot of learning towards in the last 4 years. Now we are scaling. We have around 20,000 users in our platform. We are scaling on a monthly basis. At the same time, we wanted to make sure our platform and infrastructure can support it. That's the reason why we have partnered with Microsoft, partnered with AWS to drive our vision forward. Thank you.
Thanks, Jiraj. At this point, I would like to turn it over to Aaron Smith, a pharmacist that works in our National Specialty Pharmacy Program that really has created some use cases and ways to take advantage of some of the digital tools that our Bayshore digital team has built. Over to you, Aaron.
Awesome. Thanks, Kevin. Yeah, I'm here today to just discuss the digital transformation at our pharmacies, as well as Wave's role at Bayshore Specialty RX. I just want to give some background about Bayshore Specialty RX. It's comprised of many business units. I lead the specialty pharmacy team nationally, and we collaborate with the other business units to ensure patients have timely access to life-changing specialty medications. Next slide, please. I'd like to take a moment to talk about digitizing healthcare in Canada. Thanks to COVID-19, there was immense pressure placed on the healthcare system to pivot from an in-person model to a virtual or digital model. The healthcare industry, including pharmacy and nursing services, is presented with an opportunity to reevaluate traditional practices and identify areas where digital solutions are appropriate and even a preferred tool for patient care. Outside of a pandemic, factors that are increasing pressure on our healthcare system are Canada's large geographical size, our aging population, and healthcare staffing shortages. I believe incorporating digital solutions into our pharmacy practice is a sustainable option to support Canadians to access quality care. So what are the benefits of incorporating digital care into our practice? The first is accessibility. Many Canadians, including our Bayshore patients, live rurally. Investing in virtual care will level the playing field for Canadians to access specialized and knowledgeable care providers, such as our pharmacists and nurses. Although I do need to mention the need for government infrastructure investment to ensure that high-speed internet access is equitable nationally. Secondly, there's the benefit of privacy. Patients have the choice of environment that they find most suitable for these conversations. There's also the benefit of efficiency for both patient and healthcare professional. Our pharmacists and nurses can care for more patients per day. Patients can avoid travel costs as well as reduced work absences and childcare costs, thus improving work-life balance. And for every 100 virtual appointments, 400 hours of time are saved. And lastly, autonomy. At Bayshore, we value patient-centered care. This means we allow patients to choose the method of care that is ideal for their individual circumstances. Virtual care is quickly becoming a preferred communication method with both the younger demographic as well as patients managing chronic conditions. In one poll, 70% of Canadians managing a chronic condition preferred virtual care over in-person. At Bayshore Specialty RX, we set out to identify areas where we can digitize our patients' care. We started by really understanding our patient population and the care team members that interact with them. We identified several digital health tools with the ability to support our patients in their interactions with Bayshore care providers. And from there, we were able to identify specific tasks that we targeted to use virtual care, such as medication reviews and injection training. Next slide. Wave is a great fit for Bayshore Specialty RX because of the complete solution that it offers. I really appreciate the feature that permits syncing with our staff's Outlook calendar, as well as the consent management. These features reduce the administrative burden on our staff. Patients appreciate the self-scheduling option, including the ability to reschedule their appointment themselves, as well as the automatic notifications and reminders. Here's an example of a patient using Wave to book a virtual consultation with a pharmacist or nurse. The patient uses a link to book her one-on-one appointment with a pharmacist or nurse on Wave. Wave allows the patient to self-select from available appointment times based on their personal preference. The link to the appointment is then emailed to both the patient as well as the pharmacist or nurse. They meet for their virtual visit to review the patient's concerns and create a plan together to achieve the patient's health goals, or in the case of a nursing appointment, to provide injection training. And following the visit, the patient can book a follow-up appointment via Wave and will receive automated notifications via Wave. In conclusion, Wave is an effective and easy to use virtual care tool for pharmacy and nursing staff, as well as patients.
Thank you, Erin, for the overview. Next, I want to move on to Anita Fitches, who oversees our integrated care solutions group and has really is doing some interesting work in terms of figuring out how to integrate technology to produce better outcomes for the patients that her teams oversee. Anita?
Thank you, Kevin, and it's a pleasure being here today. And I'm going to just give you a little overview of the RPM journey that we've been on here. Just maybe firstly, I'll mention Integrated Care Solutions is a division within Bayshore, and we partner with hospitals to deliver bundled funding transitional care programs in the community. So RPM for us here at Bayshore has really been about moving more healthcare out of traditional settings such as hospitals, the ability to get patients home sooner and a little faster to where they live and work and really want to be on a daily basis. And our solution has been about using technologies so that clinicians have the opportunity to see what's happening with their patients early on. And this in turn really enables them to ask more relevant questions, hopefully in advance of a significant event or an exacerbation that a patient might have. And we really want to ensure that our clinicians have the right patient data so they know on a daily basis how to support those patients and really make the right informed decisions in managing their care. So the goal of our program really was developed to have a more holistic approach to our patients and their health, as well as really proactively preventing those hospital visits. We currently really offer two types or streams of RPM. One is an add-on to some of our current existing programs in the community, and another one is just the standalone. So if a patient only requires just RPM. And we see patients with cardiovascular diseases, respiratory infections like COVID, as well as chronic diseases as well. And next slide. So this is an actual snapshot of our dashboard. This was developed by Daraj, who you just heard from, and his team over the last couple of years. It's a cloud-based customizable dashboard for nurses to remotely monitor their patients. It provides alerts when patients go outside of their set threshold. It also provides historical trends on each of our patients, and it triggers reminders to our clinicians. Over time, we've made some improvements and enhancements as well to better support the patient experience and broaden our patient population. So some of that includes push notifications to patients for things like reminders to take their vitals, answer their check-in symptom screening questions, or complete surveys. We're also working on a clinical documentation library directly in the app for patients to access training materials, FAQs, exercises, diet suggestions, all very targeted to their condition. Because the dashboard has been customizable and we actually can customize individual thresholds for patients, this has really helped us in getting to patients sooner and really supporting them. And you'll see, even in the next slide, I'll talk about a little bit more, but our referral or escalation rate to ED is really low. It's less than 1% as a result. Next slide. So we've been using this solution for about 2 years now. We've partnered with 2 hospitals to offer RPM, and patients receive a data-enabled tablet and monitoring devices appropriate for their condition. They're required to take their vitals per a customized schedule and answer any health check-in questions related to their symptoms and screening and management. And our clinical lead and their team monitor this dashboard where the data feeds into. They're notified when patients trigger outside of certain thresholds, and then they will follow up. And they will follow up with a phone visit, a virtual visit using our WAVE solution, whatever might be required, and even escalate to a nurse coming into the home for a further assessment. We may also refer to primary care and ultimately to our nurse practitioner or physician on call as needed. So there is some data across the bottom there. You'll see there's 58 patients in this particular program that we're showing you. And you'll see that the escalation from the team, the number 16 there, what that actually means is outside of their regular scheduled visits and care plan, we sent a nurse out. 16 visits were required for 58 patients in addition to their regular scheduled care. And so, there was triggers and alerts, and based on judgment, we were able to go out and visit. And as you can see then, the referral to primary care was only 2, and to ED was 2 or less than 1%. So pretty significant impact there. Next slide, please. So we're seeing some really positive outcomes from our patients and our families. Not only do they feel supported by the program, but they also feel using the devices really increase their ability to self-manage their symptoms. People like to see their data. And as a result of that, we felt they were more engaged. One of the other things that we did learn is it was really important early on that we went into the home and we set up the devices with the patients in person so they were comfortable using them as well as the tablet, and that created a lot of buy-in as well. And they were really happy to refer this program. We had 88% who said that they would. So overall, good experiences. We're continuing to learn though, however, and we want to continue to further improve accessibility, be able to spread to other populations and to create efficiencies. So more to come. Thank you. And I'll pass it on now to Sherry.
Hi, everyone. My name is Sherry Natisha Webster. I am the Managing Director for CarePath and CareChart Digital Health. So the CareChart Advantage is we have three basic principles. Our platform that combines people and technology, offering a customized and comprehensive patient support solution. Our people, they're highly trained and compassionate. And we have the ability to provide support in over 300 languages. And our promise is to provide quality of life and positive outcomes for patients and their families. Next slide. CareChart Digital Health delivers population-based virtual care at scale. We currently provide virtual care to 74 hospitals and cancer centers across the province of Ontario, delivering oncology symptom management nursing support to patients when their treating centers are closed. Over the past 24 months, we have managed over 52,000 patient virtual visits, and we've prevented approximately 35 ED visits. Next slide. So our app, this is a bit about our programs here. We have our oncology program, which we actually started as a pilot in July 2016. So we've been doing this for quite a few years now. And our palliative care program, we're currently piloting that in the Northwest region of Ontario. And I'll talk a bit more about some of the pieces of our palliative care program on the next slide. So I really kind of wanted to focus on the app, and our app was built, our CareChart app was co-designed with oncology and palliative care patients and their families, our frontline nurses, and Bayshore's digital team. It offers patients an omni-channel communication experience. Our app is built in patient self-reporting assessment tools, such as the Edmonton Symptom Assessment System, better known as the ESAS tool for palliative care patients. And for our oncology program, better support our nurses, we built in the Pan-Canadian Oncology Symptom Triage and remote support practice guides in our clinical documentation platform. Next slide. In October 2022, CareChart and Ontario Health, Cancer Care Ontario, received the Canadian Association of Nurses in Oncology Award Lectureship. This award recognizes excellence in clinical practice and the application of innovation, nursing interventions, and initiatives that improve patients' quality of life. During the conference, we presented a special plenary lecture at the CANO conference, and along with, we will be publishing a paper collaborating across settings to shape the future of oncology nursing after hours toxicity management support. And that will be published this fall in the Canadian Oncology Nursing Journal. CareChart's approach to virtual care can be used with other chronic disease patient populations and scaled at a provincial level anywhere in Canada. Currently, we are piloting the oncology program in Quebec, and we're looking forward to the results of that pilot and the spread across the country. Thank you.
Thank you, Sherry. So that concludes the presenters that we have, and ultimately just this whole convergence of technology and care is what is incredibly powerful, but one has to have the capability to scale and build. And the DX platform that our Bayshore's digital team built really provides us with this opportunity to experiment and to scale and to do it in a way that's compliant, and partners like Microsoft, AWS are really, foundational in terms of our ability to scale these platforms across. Now, we do have a number of questions that were put forward, so I think we probably should walk through as many of those as we possibly can. And I guess I will skip up to the beginning of this. Diraj, some of these are technical questions. I think the first one that we have here is Wave a custom-built solution for Bayshore? Diraj, do you want to comment on that?
Yeah, absolutely. So Wave as a platform, there is a light custom build codes into it, but it's primarily an augmented platform where we are leveraging technologies like Microsoft Teams, Microsoft Zoom, and connecting the schedules with our Microsoft Outlook. So that connected experiences we are doing through some low-level codes, but end of the day, it's more like an augmented technologies coming together to provide that experiences.
Thanks, Diraj. The next question I wanted to move to, and Aaron Smith, our resident pharmacist, I'll turn this over to you, Aaron. Do community patients receive medications via mail? And are community patients considered acute inpatient hospital? So I'll let you answer that, Aaron.
Yeah, you bet. Yes, our pharmacies do deliver medications to patients across their respective provinces. So via a variety of different logistic methods. Some of the patients are on the more acute scale, but most of them are more chronic or dealing with chronic conditions rather than acute. It would be more the home health team that would be managing more hospital at home patients.
Thanks, Aaron. Duraj, back to you. Just maybe a little bit of follow-up. Can you integrate Wave and third-party websites?
Yes, absolutely. All the platforms and integrated products are API friendly. So we can provide APIs to provide that integrations, or we could be delinking, whichever scenarios you wanted to go through. But depending on the use cases, absolutely, Wave can be integrated to third-party websites and applications as well.
Thank you. Next question, Anita, if you could handle it. Do you have any information about cost savings from RPM? The $1 million question or about patient monitoring is about the cost. Anita?
Yeah, so I would say that we're a little bit earlier days, but what we are seeing is that we have been able to reduce our in-person visits with some of our planned visits already in the care plan. So when we have an ability to monitor patients more remotely and through the dashboard, we've found that we haven't had to visit them as often as we would have normally in our original pathway as planned. So we are seeing some reduction there in costs by moving it to more virtual support.
And a couple more RPM related questions around thresholds created on, are they automated or they need to be done manually?
Yeah, so they're manually today. They're inputted by the team, and it's really based on the referral that comes from the hospital to us as well. But no, they're manual at the moment. We input them into the system.
And maybe the next question back to Duraj around, can RPM use patients' own wearables and devices too, or just what's provided to them by the provider? Duraj?
Yeah, yes, I can happily take this. So we are building our RPM enhanced version will bring capabilities like BYOD, bring your own devices and connect into our ecosystem. It does integrate, our accelerators can integrate easily with iPhones and Android Fit devices. So those accelerators are already available through our platform. So simple answer is yes. You can bring your own technologies, connect into our digital front door and the data flows.
And another question here, Duraj, who supports the devices network in integration should there be a technical problem?
Yeah, so far our RPM is not scaled to that extensive scale yet. So my team is actually supporting this into smaller scenarios, but we are partnering with a few firms out there in Ontario just to provide that extensive support use cases. For example, the hardware handling, the shipping, and the logistics aspects, we are almost close in putting a partnership out there. So we are looking at scaling RPM as we speak now.
I'm going to keep you on the hot seat here for a couple more questions, Duraj. How does this data interact with a hospital information system that may have a portal?
Right. So currently how we are doing is we are bringing the streaming data right into our public cloud infrastructures, and we are hardening that in Microsoft Cloud and AWS Cloud. Now, the way that hospital system wants, what format do they need that data from, we are able to bring that data back to them. But it's up to the hospital to set standards, saying what data standards they need to get this data in. We are ready to provide that data exchange mechanisms. Today, we support data exchange through APIs, webhooks, event queues, whatever connection technologies out there. It's just a matter of specific use case, and hospitals also coming into the picture to say this is how we want to expect the data. We are able to provide the data in that format.
Another question, do you feed any data repositories like Connecting Ontario for Collaborative Care? Duraj again.
Yes, we do have that in the roadmap. Currently, we are just more focused on connecting our internal Bayshore ecosystem to work well, pilot, prove it, then we start branching out to the provincial assets. We do have a use case today that we are looking at integrating with Ocean's referral networks when it comes to RPM offering, and we are just looking at launching that soon. But yes, to go extensive on the provincial asset integrations, it's actually in the roadmap.
And how can technology better support an integrated care model that includes pharmacy? Erin, do you want to comment on that, or Daraj both? Erin, I don't know if you want to have a comment.
Yeah, sure. I think, just with all of these tools, everyone's becoming more comfortable with Teams and everything like that. Any tool that allows more collaboration and connectedness between our teams will help to promote referrals between different professions within Bayshore. So I think just having that ability to connect quickly with other team members will help us to get patients the care that they need by the best team member.
Yeah, in my perspective, what we are going to add is today, if you look at a care worker's phone or interfaces they use to actually interact with the technologies is getting very cumbersome and very long, 5-7 screens, and it's just creating a spaghetti of a lot of apps sitting on their phones and laptops. So what we are trying to do is through our digital front door, how can they just interact with that information they require to actually provide that point of care? That's what we are also focusing on, building out the digital front doors and the experiences for our mobile field workers, which we feel like it helping a lot in terms of operational efficiencies and making that program automated in a meaningful way. So we're working through it. Hopefully those conversions will come, and those meaningful conversions will come soon.
Over to Peter is a question. How is Microsoft helping Bayshore build out new connected care models? Daraj and/or Peter?
Yeah, I could probably answer some of that. The work Microsoft is doing with Ontario Health and building out the Ontario Health data platform, I think is key to allow for that data interoperability to happen across the province. We're starting to see, the Microsoft Cloud for Healthcare to really start to enable the APIs. And, what Daraj is leveraging is a lot of that rebuild of the APIs and the connectors using all the HL7 and FHIR standards that allows us to do that data sharing across the province. The other important piece to touch on is if you think about Teams as that clinical collaboration tool being used by acute care, community care, and home care, we've now built in functionality into Teams that allows you to federate and align Active Directories from multiple organizations. So you can federate and share documentation in a secure, compliant way. So this will really light up the ecosystem to allow organizations to share data as well as communicate and collaborate across the system.
And the interesting fact, just to add to Peter's thing, is the interesting fact about what we are doing with Microsoft is also building a multi-tenant and that integrated B2B platform so that any organizations can come in and become a subscriber to the platform and start running their own RPM solutions or value-added offering on top of their services they provide to their patients today. So we are truly partnering with Microsoft to build out that B2B multi-tenant SaaS platform as a service kind of concepts. And that's what is coming. We'll be launching soon in next month or so.
Just another next couple of questions. I may take a bit of a stab at them, and then if other team members want to, why do we invest in a digital experience platform? I think one of the two big reasons, ultimately, from my perspective, one is the experience is not great for patients, and how could we make it better? And new technologies are coming available, and obviously we all lose them in our personal lives out there when we're ordering pizza or whatever we're doing in our own personal lives. We're using technologies that make things incredibly convenient for us as individuals in the larger world we live in. And we need to bring some of these things to healthcare and make it better for patients and create that better experience. We also ultimately know that the legacy systems just aren't able to move the data the way we needed to have that done. And with some of this new work that we've done at Bayshore, we're now able to really deliver data to patients and information to patients and create transparency that otherwise we just would not be able to do. So it's exciting when we can provide an update to a family member digitally on an app and they feel comfortable that mom's good, or they can check a schedule. Some of those basic things that they may have had to make a phone call before, they can now check digitally on their mobile device. How do we think about innovation at Bayshore in terms of some of this? We let the people that are operators and clinicians across the organization bring forward ideas and bring forward use cases and look at opportunities. We also have lots of discussions with partners. Anita works with hospitals, Sherry works with hospitals, I work with OH. They're constantly having conversations, and we're making them aware of some of the capabilities we have as an organization that we can bring to the table to make a change, innovate, and do something different in a program, again, to change patient experience, provide accessibility to data. And there is a win here as well from you're eliminating a lot of steps that we have a shortage of healthcare professionals. And if we can do things digitally, there's opportunities for us to better leverage healthcare professionals to create more value adds with their time, as opposed to getting caught up in administrative trivia or clunky experiences themselves as they help support patients. Suraj, I don't know if there's anything else that you wanted to mention with those two.
No, you have said it all. Like I said, we are building the core part of the platform scenario is we are building this with major cloud providers. So we don't really need to recreate the engine, reinvent the wheel. It's all the modular components are available for us to actually design and build and move faster. So that's a whole concept around a platform journey that we took a few years ago, and happy to see that there's a lot of traction since the platform. That platform as a launch pad has given to Bayshore to drive more things to experiment, more innovation, and different ways of providing care models. So I'm happy to see the advancement.
There was a question as well, George, around RPM solution. What is the RPM solution built on? Is it custom built? And just a little bit more details about that.
Yeah, absolutely. So we started RPM as a single page applications, especially when it comes to the clinicians and operators view. How do you actually provide them the data for them to make those data for investigative purposes to take actions around it? But on the patient side of things, they have a mobile app, which is the same digital front door, which we call as My Bayshore Care. They have an account. They can actually see a patient, or their family members can see how their loved one is doing in terms of the RPMs and the programs they have assigned in the RPM ecosystem. So it's just two different breakpoints. One is the mobile breakpoints for patients and families. One is the laptop and web breakpoint for our operators and clinicians. So it's was built on a single page applications. Now we are transforming that applications over to Microsoft Cloud for Healthcare. So we are leveraging Microsoft's capabilities to drive that enhancements and that healthcare integrational use cases forward. So that's where Microsoft Cloud for Healthcare, we partnered with them, and we're very excited to be launching this new enhanced RPM model into the market soon.
Just probably one last question on technology, which means Suraj taking a glass of water maybe and continue. Are you using a single API platform or multiple? And are you needing to build your own APIs, or is there an existing library you can benefit from?
Yeah, so we do have built extensive libraries of APIs, packaged microservices. It's all available. So what we do is when we time to exchange of data to other partners, that's when we open up our libraries for them to consume the data. But so far, what we are in the business of consuming the data from other technologies and other systems, and we are just managing in our API gateways. We have a couple of engines in our ecosystem, like MuleSoft. We use AWS Lambda and all those things to drive those API connectivity forward.
Great. Just one last question, then I think we'll come close to signing off. There's a question around metrics for innovation and business cases, and if our CFO is on the call listening, hopefully he can close his ears. We have not been as we believe we do have to experiment, and we do need to spend money on R&D. We just can't. If we business case everything and try to put a spreadsheet for ROI and everything that we do, we're not going to innovate as an organization. So we set aside dollars every year that there isn't necessarily a finite business case or a spreadsheet that drops to the bottom, because we're doing new things. We're doing things we've not done before. And this is an experiment for us. And some of these experiments are paying off because we're we're now having more and more partners come to us and ask to work with us. They see that we're committed to, co-designing with patients. We're committing to investing as an organization. And, so I think there's been great payback for us, but not the kind that maybe a traditional business case. As we move forward, we probably will move more to business cases, but we're still at the point where this is an innovation journey, and a journey that we think is important to help change healthcare outside of hospitals. Just the final comment here before we sign off would be that obviously some individuals have noted that they'd like to connect with some of the members of our team or some of the members of the panel today. So I will probably lean on Digital Health Canada to provide the appropriate email addresses sent out so that people can connect with members of this call if they wanted to follow up with additional questions. Or we do love to partner. So if anyone is out there in the larger ecosystem is looking for a home community pharmacy provider to do something interesting and innovative, showing up and asking us some questions is definitely something that we would love to do with. We need partners. Partners need to be patients, and also partners need to be people playing in the healthcare system at large. So I think that brings it to an end for today. Thank all the team members from Bayshore for their presentation, and also wanted to thank as well, again, Peter Jones for coming on from Microsoft to help us today as well. Thank you.
Thank you.
Ashley, you have a couple of comments at closing?
Yes, thank you. What a great presentation and great engagement in our chat box. As Kevin mentioned, if anyone has any further questions for any of our presenters today, feel free to send an email to webinars@digitalhealthcanada.com. As well, most of the presenters here, their names were connected to their LinkedIn accounts, so feel free to reach out to them directly if you want to continue the conversation further. All right, and I have also put in a link in the chat box for a quick survey. If you have any further comments, feel free to type it in there, and that will go directly to the presenters as well. All right, so if anyone has any last minute comments from the presenters, this is the time. Peter, if you have any last minute words, Josh, Aaron, anyone? Just a big thank you all for being here today. All right, so we'll just end it here. Well, thank you again to all our presenters for great presentations and all the questions that came in from the chat box to our attendees. Great engagement. Again, if you have any further questions for the presenters, feel free to send it to webinars@digitalhealthcanada.com. All right, thank you all for being here today, and have a great rest of your afternoon.
Thank you very much.
Yeah.
Thank you very
Everyone
much.
for having us. Bye.